Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Sedef Dagli. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, doctor. Good morning.
Good morning. Tell me, what's your problem?
Well, I have a 9-year history of occasional palpitations. Symptoms occur 3 to 4 times per year, and they last for an hour or more, and my heart beats more rapidly, but I've never measured my heart rate. The most recent was yesterday. It's associated with feeling of darkness descending as if a shade was being pulled down in front of my vision. However, I don't lose consciousness. Yesterday, while working on a computer, I had a spell. Palpitations persisted for a short time.
Okay, what's your age?
48, doctor.
Do you smoke or drink alcohol or use caffeine?
No, doctor.
Is there any family history of congenital heart disease?
No, doctor.
You had any history of thoracic trauma or thyroid disease?
No, doctor. I had anterior cruciate ligament reconstruction, complicated by contact urticaria from a neoprene cast.
Are you taking any medications?
No, doctor.
Are you allergic to any medication or substance?
Yes, I am allergic to neoprene.
As per your physical exam results, your pupils are reactive. Sclerotic mucous membranes are moist. Neck veins not distended, no bruits. Lungs are clear. Cardiac exam is regular without murmurs, gallops, or rubs. Abdomen is soft without guarding, rebound masses, or bruits. Extremities well perfused. No edema. Strong and symmetrical distal pulses. A D-dimer was mildly elevated to 5. CT scan showed no evidence of pulmonary embolus. Moreover, there is no progression over the 9-year period that you have been symptomatic, suggests that this is an unlikely cause. 2-dimensional echocardiogram shows no evidence of clinically significant structural or functional heart disease. A 12-lead electrocardiogram shows sinus rhythm with normal axis and intervals. No evidence of a pre-excitation. Lab reports show no evidence of myocardial injury. You have episodic palpitations and presyncope. I would suggest outpatient workup. Event recorders should be obtained, and I will see you again upon completion of that study. I would prescribe suppressive medication, beta blocker, or cardizem. There will be symptomatic improvement of the disease through it.
Extract 2, questions 13 to 24. You hear an optometrist talking to a patient called Dominica. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good morning, Mrs. Dominica. How can I help you?
Good morning, sir.
Can you show me your registration card? Or should I search your details through your mobile number?
I think that would be better. My mobile number is 078-823-78979.
Okay, I've tracked your record. You last visited on the 27th of August 2016.
That's correct.
Just pay the doctor's consultation fee here.
Sure, this is my card.
Please take your seat and feel comfortable. Should I help you with water, newspapers, etc.?
Thank you. Hello, doctor.
Hello, Mrs. Dominica. So how can I help you?
I just came for a regular checkup for a suspected case of glaucoma. 18 months ago, Dr. Gonzalez advised me to undergo a precautionary checkup once a year, knowing my family history of glaucoma and after examining my eye. He told me that my optic nerve is thicker than the usual.
That's probably the reason you were asked to undergo a precautionary checkup every year. You can have the visual field analysis and OCT today. And once you receive the 2 test reports, let's meet again in the afternoon.
Okay, doctor.
Yes, Mrs. Dominica?
Hello, sir. The doctor advised me for these 2 tests.
Okay, The 2 tests would cost you £200, and you'll get the test reports in around 3 hours. Is that okay with you?
That's fine.
Please be seated here. Someone will call you back for the first checkup in just a few minutes.
Thank you, sir.
Hello, Mrs. Dominica. I hope you had a good experience going through those 2 tests.
Yes, it was. And since I've taken the test before, I know what to expect.
Your test reports are perfectly okay. Since these reports haven't shown anything suspicious in so many years, I think you can now take these tests once in 2 years and not every year.
Okay.
Well, that puts the glaucoma thing to rest. Do you work on the laptop for long hours?
Yes, doctor. Being the chief accountant, I have to work all day on computers.
If your eyes become tiresome very quickly, I will recommend an eye drop that can be applied thrice a day. Generally, the eyes become tiresome when we continuously look at the computer screen without blinking for long. In such a case, this eye drop would lubricate the eyes.
Actually, I see a few black, thin, wavy structures floating before my eyes that don't disappear even after closing my eyes. What are they? Will it cause any serious problems to my eyesight?
Not actually, they're called floaters. As we age, floaters develop to different extents. They're not harmful. Actually, floaters may appear like gray or black specks, cobwebs, or strings that float during eye movements and appear to break away when you look at them directly. Generally, most eye floaters are caused due to age-related changes that occur as the jelly-like substance called vitreous inside the eye becomes more liquid.
Are they very serious, doctor?
Getting a new floater or the appearance of light flashes are the signs that the vitreous gel is pulling on the retina that can lead to a retinal detachment, a serious condition that can be treated with a surgery.
Can anything be done about the floaters in the eye?
Rarely, floaters may become very dense and plentiful and affect the eyesight. In such cases, a surgical procedure called vitrectomy may be suggested to remove floaters from the vitreous. A vitrectomy is performed to remove the vitreous gel along with the floating debris from the eye.
How can I get rid of floaters, doctor?
Normally, most of the eye floaters don't require treatment. It requires some patience and caution to get rid of them over time. When floaters become so large or numerous, they can impair the vision.
What kind of vitamins will be effective to treat floaters?
Although our government doesn't approve the Food and Drug Administration for treating floaters, there is anecdotal evidence that intake of vitamins can improve the eyesight and reduce the dominance of floaters. You can take a vitamin A supplement that includes selenium, magnesium, and DHA, as these nutrients help to treat floaters.
Can you suggest to me some foods that will be effective to control my eye floaters?
Well, you can indulge leafy green vegetables like spinach, kale, and collards in your meals. You can also have salmon, tuna, and other oily fish, eggs, nuts, beans, and non-meat protein sources. Citrus fruits or juices such as orange, oysters, and pork in your diet.
Thank you, doctor. Thanks for your time.
You're welcome.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now look at the question 25. You hear a monologue by a physician explaining about gallstones. Now read the question. Gallstones are formed due to an imbalance in the composition of bile, resulting in hard stones that are made of pigment or crystallized cholesterol, or a mixture of the two. They can range in size from as small as a sand grain to as large as a tennis ball. One can have a single large gallstone, dozens to hundreds of smaller gallstones, or a combination of both small and large stones. There are 2 types of gallstones. Typically, patients with pigment stones have cirrhosis of the liver, biliary tract infections, and hereditary blood disorders, including sickle cell anemia. These are all conditions that produce too much bilirubin, of which the stones are made of. Pigment stones tend to be dark brown or black. Cholesterol stones are formed as a result of bile that is made of too much cholesterol or bilirubin and not enough bile salts. They can also form when the gallbladder fails to empty during the digestive process. They are usually yellow-green gallstones, which are the most common type. Question 26. You hear a discussion between a nurse and a doctor on Crohn's disease. Now read the question.
Hello, doctor. What are the different types of Crohn's diseases?
Well, Crohn's disease is a chronic, incurable disease that can cause inflammation anywhere along the digestive tract. Crohn's disease is characterized by symptoms of abdominal pain, diarrhea, cramping, weight loss, bloating, and blood in stools. Crohn's disease affects people differently, mainly due to the different types of the disease and the areas they affect. The most common types of Crohn's disease are ileocolitis that affects the colon and adjacent ileum, jejunalitis affects the jejunum, ileitis affects the ileum, Crohn's granulomatous affects the colon, gastroduodenal Crohn's disease affects the stomach and adjacent duodenum. Question 27. You hear a discussion between a nurse and a doctor on diagnosis methods for endometrial cancer and its stages. Now read the question.
Hello, doctor. What are the methods of diagnosing endometrial cancer and its stages?
Endometrial cancer is the main type of uterine cancer, starts in the cells that make up the endometrium, and then shed each month during menstruation. The cancer is only in the uterus during stage 1. During the stage 2, the cancer is in cervix and uterus. The cancer spreads beyond uterus within the pelvic area during stage 3. And during stage 4, the cancer has spread outside the pelvic area to bladder, rectum, or other parts. The diagnosis for endometrial cancer include a computerized tomography scan, chest X-ray, positron emission tomography scan, and blood tests. The results of these diagnoses will determine the cancer stage. Question 28. You hear a discussion between a nurse and a doctor on types of hemorrhoids and their effects. Now read the question.
Hello, doctor. What are the types of hemorrhoids and their effects?
Well, hemorrhoids are a common but aggravating condition involving inflamed and swollen veins in the rectum or anus. Often, external hemorrhoids are identified by a lump on the surface of the anus. These tend to be the most uncomfortable because they are nerve endings in the area. Anal pain, itchiness, tenderness when wiping are some of the symptoms. The pain can become especially severe if the hemorrhoid clots. Typically, internal hemorrhoids are painless and undetected with no visible signs. Pain can occur if the hemorrhoid begins to prolapse out of the anal canal, though this is rare. If the hemorrhoid becomes fixed outside of the anal canal, the pain can often be excruciating, especially if thrombosed. On rare occasion, such hemorrhoids will require emergency care. Question 29. You hear a discussion between a nurse and a doctor on different categories of chemotherapy drugs. Now read the question.
Hello, doctor. What are the different categories of chemotherapy drugs?
There are several types of chemotherapy drugs that vary both in their functioning and on which part of the cell cycle they work. Alkylating agents are nonspecific drugs that directly damage DNA. Examples include Cytoxan and Myloran. Antimetabolites work by pretending they are nutritional sources for the cell. Cancer cells take up these drugs instead of nutrients and essentially starve to death. Examples include Navalbine, VP16, and Gemzar. Plant alkaloids include drugs obtained from plant sources. Examples include Cosmogen and Mutamycin. Anti-tumor antibiotics differ from the types of antibiotics used to treat bacterial infections. These drugs work by preventing cancer cells from reproducing. Examples include Adriamycin and Cerubidine. Question 30. You hear a discussion between a nurse and a doctor on different types of anemia. Now read the question.
Hello, doctor. What are the different types of anemia?
Anemia results from a decreased number of red blood cells or hemoglobin, the protein that carries oxygen. Anemia can result from iron deficiency, sickle cell disease, or thalassemia. Neutropenia is a decreased number of neutrophils, a type of white blood cell, which are an essential part of our immune system that fights off bacterial infections. There are numerous causes, including autoimmune neutropenia, Shwachman-Diamond syndrome, and cyclic neutropenia. Polycythemia vera is a condition in which our bone marrow makes an excessive number of red blood cells. This increase can elevate your risk of clot formation. Immune thrombocytopenic purpura is a condition in which the platelets are marked as foreign and are therefore destroyed. This can lead to very low platelet counts and bleeding. Thrombocytosis is a condition caused by an increased number of platelets.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear doctor giving a lecture to the junior doctors on lung carcinoid tumors. You now have 90 seconds to read questions 31 to 36.
We all know that cancer begins when the cells begin to grow out of control. Cells in any part of our body can become cancer and can metastasize to other parts. Significantly, lung carcinoid tumours are uncommon and grow slower compared with other types of lung cancers. Lung carcinoids are made up of special cells called neuroendocrine cells. Before we try to understand lung carcinoid tumours, it is essential to know something about the structure and functionings of the lungs, as well as the neuroendocrine system. Our right lung has 3 sections called lobes, and our left lung has 2 lobes. The left lung is smaller because the heart takes up room on that side. When we breathe in, air goes into the lungs through the trachea. The trachea divides into tubes called the bronchi that enter the lungs and further divide into smaller branches called the bronchioles. At the end of the bronchioles, there are tiny air sacs called alveoli, from where many tiny blood vessels run through. These blood vessels absorb oxygen into the bloodstream and pass carbon dioxide into the alveoli, which is exhaled. Therefore, the main function of the lungs are inhaling oxygen and exhaling carbon dioxide. A thin lining, known as the phleura, surrounds the lungs, which protects the lungs and helps them slide back and forth as they expand and contract while we breathe. Phleura capacity is the space inside our chest that contains the lungs. A dome-shaped thin muscle called the diaphragm below the lungs which separates the chest from the abdomen. Therefore, while we breathe, the diaphragm moves up and down, forcing the air in and out of the lungs. Lung carcinoid tumours develop from the cells of the diffuse neuroendocrine system, made up of the cells that are similar to nerve cells and hormone-making endocrine cells. These cells do not form an actual organ like the thyroid or adrenal glands. Instead, these cells are scattered throughout the body in organs such as the intestines, stomach, and lungs. Neuroendocrine cells secrete hormones such as adrenaline and similar substances. This may help control airflow and blood flow in the lungs and may help control the growth of other types of lung cells. Neuroendocrine cells may detect the oxygen and carbon dioxide levels in the air we breathe and then discharge chemical messages to help the lungs adjust accordingly. For instance, people living at higher altitudes will have more lung neuroendocrine cells because of the decreased oxygen level in the air they breathe. At times, lung neuroendocrine cells undergo certain changes, causing them to grow big and form tumours. These are known as neuroendocrine cancers. Lung carcinoid tumours are a kind of neuroendocrine tumour. However, neuroendocrine tumours can form in any part of our body. Stomach is another common site for neuroendocrine tumour formation. There are 4 different types of neuroendocrine lung tumours. Starting with the aggressive growth of the cancer, the 4 types are small cell lung cancer, large cell neuroendocrine carcinoma, atypical carcinoid tumour, and typical carcinoid tumour. Small cell lung cancer is one of the aggressively growing and spreading tumours. Large cell neuroendocrine carcinoma is a rare type of cancer. It is a subcategory of non-small cell lung cancer, though it grows aggressively like small cell lung cancer. Typical and atypical carcinoid tumours are carcinoids that appear different under the microscope. Typical carcinoids grow slowly and they rarely spread beyond the lungs. 90% of the lung carcinoids are typical carcinoids. Atypical carcinoids grow a little faster and they are likely to spread to other organs. They contain more cells in the process of dividing and they appear more like a fast-growing tumour. Unlike the typical carcinoids, atypical carcinoids are uncommon. At times, carcinoids are classified by where they develop from inside the lung. Central carcinoids form in the bronchial walls near the centre of the lungs, and most lung carcinoid tumours are central carcinoids, which are also typical carcinoids. Peripheral carcinoids form in the bronchioles towards the outer edges of the lungs.
Now look at extract 2. Questions 37 to 42. You hear the monologue of a physician giving a lecture on scleroderma. You have 90 seconds to read questions 37 to 42.
Hello, doctor. Could you please explain different types of scleroderma?
Well, scleroderma is a symptom of a complicated group of diseases by an abnormal growth of connected tissue that supports the skin and internal organs. This disease is also termed as systemic sclerosis. Scleroderma literally means hard skin, derived from the Greek words sclerosis, meaning hard, and derma, meaning skin. Scleroderma is considered both rheumatic disease, since the conditions are characterized by inflammation and pain in the muscles, fibrous tissues or joints, and a connective tissue disease. Certain types of scleroderma have a limited abnormal process that primarily makes the skin hard and tight. Other types are more complicated, affecting the internal organs, such as the lungs, heart, and kidneys, and the blood vessels. A phrase identified as softening occurs, during which less collagen is produced. There are two main classifications of scleroderma. Localized scleroderma, that affects only certain parts of the body, that includes linear scleroderma and morphea, and systemic sclerosis, that affects the entire body. Localized scleroderma. Localized scleroderma affects the skin and related tissues, and, at times, the muscles below. However, internal organs are not affected. Localized scleroderma can never advance to the systemic type. Moreover, localized types can improve over time. However, the skin changes that occur during the disease can be permanent. It may be serious and disabling. Morphea. Reddish patches of skin that thickens into firm oval-shaped areas are distinctive characteristics of the morphea type. The centers of the patches appear ivory with violet borders. The patches occur on the stomach, chest, face, back, legs, and arms. Typically, these patches sweat a little and have little hair growth on it. Morphea can limit to one or several patches, ranging from ½ inch to 12 inches in diameter, or else it can be hard and dark, spreading over larger areas of the body. Morphea generally fades out in about 5 years. However, people can have permanent dark skin patches and muscle weakness. Linear scleroderma, characterized by a distinctive single line or band of thickened, abnormally colored skin. Typically, the line runs down an arm or leg and can run down the forehead. Systemic sclerosis not only affects skin but also involves blood vessels and major organs. Patients with systemic sclerosis often have all of the following symptoms, known as CRESS syndrome, an acronym for calcinosis, formation of calcium deposits in the connective tissue. Raynaud's phenomenon. Small blood vessels of hands or feet contract in response to cold or anxiety. Esophageal dysfunction. Impaired function of the esophagus occurs when smooth muscles in the esophagus lose normal movement. Sclerodactyly. Thick and tight skin on fingers result from deposits of excessive collagen within skin layers. Cholangiotaceous. Small red spots on the hands and face are caused by swelling of tiny blood vessels. Systemic sclerosis is further divided into two categories, called limited and diffuse. Typically, limited scleroderma has a gradual onset and is restricted to certain parts of the skin, such as hands, fingers, lower arms, face, and legs. Often, Raynaud's phenomenon is experienced for years before skin thickening becomes evident. Calcinosis and cholangiotaceous often follow. At times, limited scleroderma is referred to as CRESS syndrome because of the predominance of CRESS symptoms in these patients. Typically, diffuse scleroderma has a sudden onset. Skin thickening develops quickly and covers much of the body in a symmetric pattern. Most of the internal organs can be damaged. Skin can swell, appear shiny, and feel itchy and tight. The damage of diffuse scleroderma occurs over a period of a few years. After a period of 3 to 5 years, patients tend to stabilize, a phase when progression of the disease seems little and symptoms subside, but gradually. Skin changes begin again. A phase identified as softening occurs, during which less collagen is produced and the body rids of excess collagen by itself. This is the end of Part C. You now have 2 minutes to check your answers.